We're so grateful to be partnering with Spectrum Health Zeeland Community Hospital to bring you joy at Joy99. And this month of February, it's all about heart disease.
That's right. And cardiovascular disease. February is American Heart Month. We told everybody that on the first Friday when we were wearing red.
That's right. Dr. Phatak is here with us with Spectrum Health Zeeland Community Hospital. It's a very big issue to women, right?
Yes, that's right. Women actually have the same amount of risk in terms of heart disease compared to men, especially postmenopausal women. And traditionally, it was thought that men are at a higher risk of heart disease than women, but it turns out that postmenopausal women catch up pretty soon with men in terms of the risk. So,
are there things that women can do to help lower their risk?
Definitely. I mean, diet and activity is one of the main things that people can do to reduce their risk, not just women in particular, but everyone can definitely work in their diet and lifestyle to help lower their risk of heart disease.
What are some things that you would recommend?
The American Heart Association has some specific recommendations in terms of diet as well as exercise. In general, what is recommended is a balanced approach to diet, so including all sorts of foods, but in moderation in your diet. So make sure to include whole grains in your diet, lots of nuts, legumes, pulses, 4 to 5 servings of fruits and vegetables, and minimize processed foods, minimize saturated fats like butter, fried foods, pizzas and pies and cookies and all the good stuff that we reach out for.
All the good stuff, yeah.
So as a woman, if I'm just going about my day, what kind of signs might I look for if I'm having a heart episode or something?
That's a good question, especially for women, because women tend to present differently with heart disease than men. So typically the Hollywood story of heart disease would present as crushing chest pain, radiating to the arm or going to the jaw. But women tend to present a little bit differently. So they tend to have a little more, perhaps, shortness of breath or indigestion or a reflux kind of symptoms, upper abdominal discomfort, which, women tend to minimize and think that, oh, this is not heart disease.
That's not my heart.
Exactly.
Right.
And so that's why women tend to be, take a little more time to present with heart disease and takes a little more time to diagnose them.
So if they have a couple of those symptoms, they should get it checked out?
Yeah, definitely. They should speak to either their primary care provider or seek a consultation with a cardiologist.
Doctor, how long do you wait before you make that call? I mean, is this you wait a couple days if this is persistent for a couple of weeks?
So that's a good question as well, because sometimes people sit on it for years thinking that, oh, this is reflux, I'm going to take something else.
Years,
and
wow.
We end up diagnosing them with coronary artery disease pretty late when they have blockages in more than one arteries of their heart. So I would say if this is bothering you for more than a few days, you should either seek, at least talk to your doctor to see if there's any more testing that could be done.
All right. Lots of good information. And we got to pay more attention, especially during this month of Heart Month.
Yeah.